What is hydrocele? It is the presence of abnormal amount of serous fluid in processus vaginalis. During descent of testis, there is also descent of fold of peritoneum along the scrotum. This fold of peritoneum is processus vaginalis, and the part of processus vaginalis, which covers the testis, is called tunica vaginalis. There are two types of classification of hydrocele. First, an etiological classification according to which it has two types acquired, which may be either primary or secondary, and another type congenital. The other classification is according to the type of defects. It is classified as vaginal hydrocele. It is the excessive fluid accumulation in tunica vaginalis. Let's discuss some basics. In the diagram shown, the blue-colored area is tunica vaginalis. The black ring above is deep inguinal ring. It is the most common type of hydrocele. The transillumination test is positive in this case. What is transillumination test? During this test, a bright light is applied to side of scrotal enlargement in a darkened room. The transmission of light as a red glow indicates excess fluid in scrotum. This type of hydrocele is non-communicating, that is, having no connection with the peritoneal cavity. Congenital hydrocele. It is due to patent processus vaginalis. It is a communicating hydrocele. The peritoneal fluid trickles down to the scrotum. It gives transillumination. Positive infants usually have residual peritoneal fluid in their tunica vaginalis, but that is often absorbed during first year of life. Infantile hydrocele. The processus vaginalis gets obliterated till deep inguinal ring. It is a non-communicating hydrocele. It also gives transillumination test positive in cysted hydrocele of the spermatic cord. The upper and lower ends of processus may obliterate, leaving a small intermediate cystic area forming encysted hydrocele of cord. Encysted hydrocele of the cord gives a negative transillumination test because the fluid is surrounded by a thick fibrous capsule, preventing the light from passing through. The traction test for hydrocele is a diagnostic technique that involves gently pulling the hydrocele sac to assess its connection to the peritoneal cavity. If the sac moves freely and the swelling decreases, it indicates a communicating hydrocele. If the sac doesn't move and the swelling remains, it suggests a non-communicating hydrocele. Let's discuss the causes of acquired hydrocele. Primary acquired hydrocele is due to defective absorption of fluid from the tunica vaginalis. It is mostly idiopathic. Secondary acquired may be secondary to some causes like testicular tumors, epididymitis. Orchitis. Orchitis is the most common reason. It is actually the testicular inflammation and trauma. How to differentiate between inguinal hernia and hydrocele. Hydrocele gives transillumination test positive and hernia gives negative. Hernia gives traction test positive while hydrocele gives negative. Hernia causes pain and it extends to the groin region, while hydrocele is mostly painless and usually does not extend to the groin region. Hernial swelling starts from the inguinal ring while the hydrocele swelling starts from scrotum. Hydrocele gives negative cough reflex, while hernia gives positive. Treatment of hydrocele. Tapping a hydrocele is a procedure to remove excess fluid from tunica vaginalis. A fine trocar and cannula are inserted through the scrotal skin. Following layers are penetrated. Skin, darth muscle and membranous layer of superficial fascia. External spermatic fascia. Crematorium muscle plus fascia. Internal spermatic fascia. Parietal layer of tunica vaginalis. Clinical features of hydrocele. Progressive scrotal swelling. Penis may be buried in scrotum. Testicular pain in case of secondary hydrocele. Thanks a lot. Take care, fellows.